Hi, this is Friendly Pharmacy 5. Hi, Kim, how are you?
Hey, good. How are you doing?
I'm doing well. So I wanted you to have I wanted to do a video with you today, just to kind of introduce you to the group, to our immune strengthening group. I just was wondering, Kim, if you could tell me, Kim is from British Columbia, Canada. She is a pharmacist. And she actually is an engineer turned pharmacist, and there's a little bit more to that, but we will maybe get on with the rest of her story in a little bit. Kim, can you tell us a little bit about your experience as a pharmacist during COVID-19, what that's been like?
Yes, I sure can. I just worked for 6 days in a row this past week,
Oh,
which,
wow.
as a contract worker, I'm not sure how I managed to do this. It's like not like anyone's forcing me to take these shifts, but
Bad planning.
bad planning. But anyway, yeah, it's a different world out there right now.
Yeah,
Certainly less masks than I would wish to see coming
interesting.
through, especially I've been working in Nelson, which is a super tourist town, and I've had a lot of people coming through there, from all over BC with the
Hmm.
classic, I forgot my medications, can you help me? And then they're not wearing a mask. And I'm like, cool, you're from Vancouver? Welcome to our small community with our small hospital. But
Yeah.
yeah, I've noticed it's taken pharmacy, which was already like a very fast paced, a lot of things can go wrong environment, and made it just like so much more tense. And
Hmm.
everyone who comes in is more tense. And
Hmm.
so it's been a bit of a recipe for burnout.
Have you found that the staff have been quite stressed as well? Has that improved now that we're about 5 or 6 months in, or is it about the same, or what's the kind of general feeling as far as that goes?
Yeah, I mean, I'm not great at talking about this because I work in so many different places.
Hmm.
So, like the
Hmm.
one place I worked at the very beginning of the pandemic was like significantly shorter staffed.
Hmm.
And so with all that huge prescription volume, it was, pretty wild in there. But at the same time, because it was crazy, unprecedented levels of prescriptions, and because it was the very beginning of the pandemic, we could kind of be like, you'll get your stuff in 48 hours. That's what
Mm.
we have. And people would kind of understand. Whereas now, you know, it's kind of like people want it to be back to normal, but it's not back to normal. And there's a bit of tension there.
Hmm. Hmm. And as far as drug shortages, has that been a big issue? I know you're working in a few different places, but has that been something that's been a bit of a struggle?
Specific to COVID, no, not really. There was at the very beginning maybe like 3 weeks of salbutamol, a couple weeks of like Flovent
So these are
buffers.
asthma inhalers usually used for asthma, COPD, that kind of thing, right? Yeah.
Yeah, so a lot of the asthma puffers were going short, and that was like you could see it in the prescriptions coming in. You'd have people call in and you'd go to fill a prescription that you got on a fax from the doctor, and it would
Hmm.
be for like an asthma puffer that they haven't used in 8 years. And it was purely people panicking because they had heard from the news that these things are going to go on shortage. So then they were like, oh, well, what if I get asthma? And it's like, you haven't had this for 8 years.
Right. Wow. Interesting.
Yeah, so that's
Oh,
where those shortages came from.
yeah, yeah. And that's why they were saying just kind of take what you need and then move on, and then we won't have shortages, right?
Yeah, well, and I mean, they also were using a lot more of those puffers in the hospital and giving them to people at their bedside. So there was that demand. But yeah, for sure. I mean, it's the classic, like the toilet paper thing happened with puffers.
There is a pharmacy equivalent to that.
Yeah,
That's
yeah.
what you're saying. Yeah.
Mhm.
Interesting. Um, okay, so that's really good. So I recently did a video on proton pump inhibitors. So these are stomach acid reducers that you and I know are very widely used in practice. What did you think about that video? Do you think that there's relevance to that conversation around maybe I don't know, overprescribing or lack of follow-up, or what is your perspective on that?
Oh man, yeah, totally. I mean, learning functional medicine type of stuff right now, learning
Mm-hmm.
a lot about how, a lot of people as they age actually have really low acid output, and so they don't digest their food very well, and then they get a bunch more gut issues like down the road because
Mm-hmm.
of that. So, first of all, like the necessary component to it is kind of wishy-washy. A lot of the times we'll have doctors prescribe proton pump inhibitors just because they use it as a diagnostic tool. So
Oh,
like,
to see if it helps, kind of
yeah,
thing.
so if this helps, we can assume that it's an acid issue. But then it won't help a patient, or it'll kind of maybe sort of help a patient, but their original issue is still ongoing, and there will be no follow-up, and then they'll just be on it for years.
So do
So,
you think is it kind of used sometimes as a bit of a band-aid approach?
oh yeah,
Let's just kind of,
totally.
abate this and move on. And yeah.
Yeah, well, I mean, going through pharmacy school, like that's one of the classic non-farm disease states that were, you
Mm-hmm.
know, 90% of unless you have an acid producing tumor,
Mm-hmm.
you pretty much have acid problems because you're eating spicy meals, or you're eating like really high fat meals, or alcohol, smoking, um,
Chocolate.
chemicals,
Mm-hmm.
they all can promote that sphincter between the esophagus and the stomach to relax, and then up comes the acid. So, you
Mm-hmm.
know, if we maybe spent more than 5 minutes in a doctor's appointment,
Mm-hmm.
get to that instead of just here's some esomeprazole.
And I think it's a little bit difficult for the pharmacist too, because when the pharmacist receives the prescription at the pharmacy, the person doesn't necessarily speak to the pharmacist right when they drop it off. They're sometimes talking to a
No.
technician first. And patients, when they're prescribed medications, they often just think, well, the doctor prescribed it, I must take this. And then we skip the whole process of what we call non-pharmacological measures or non-drug measures. And that's just what you were talking about, like spicy food, chocolate, alcohol, all these different things that can relax that sphincter and different things that we can do maybe before medication. And yeah, the
Mhm.
medication will help, but as soon as you
Yeah.
go off of that, you're probably back at square one. And, sometimes we could even get a bit of rebound acid production as well, right? And
Right.
that can be a bit of a vicious cycle,
Yeah,
right?
so then patients think, when you try to de-prescribe someone off of something, you have to be very careful
Mm-hmm.
about that process because you don't want to scare them away from the whole thing. Because if
Mm-hmm.
you just stop that cold turkey, your body has adapted to not to having that drug, and then all of a sudden it doesn't have the drug and it rebounds.
Mm-hmm.
Well, they're never going to trust you again with that process, and
Yeah.
they're going to
And
be on it the rest of their lives.
yeah, and that's why it's important to always do this with consultation with your pharmacist, your primary care physician, that kind of thing, right?
Mhm.
Yeah, that's really important. What about polypharmacy? So polypharmacy is often defined as something where the situation where patients taking, say, 5 or more medications, and then we start to have issues with, are they taking it correctly? What about drug interactions, that kind of thing? Do you see very much of that in your practice? Is that something that's relevant to you?
Totally. Oh
What
man.
would your concerns be with that? Are you able to kind of manage that in your practice? Do you have time for that? Like what are your thoughts?
Yeah, well, I mean, what I find the biggest struggle with drug interactions is that I'm a relief pharmacist. So I go into a place,
Mm-hmm.
and it keeps me on my toes. I can't be lazy. Like, once you've been working in the same place for a long time, you're like, oh, yeah, like I know this patient. They've been on like these 10 drugs for the last 10 years, and all is fine. And when the interaction checker thing pops up and says, here's an interaction level D, here's what could happen, you kind of go like, stable is stable, continue, and pop it
Yeah,
through.
for people that don't know, this is the pharmacy software that we use. It actually does flag many interactions, right? And then we can choose how relevant those are because computers aren't always that rational, or yeah, they don't always, but they help us, right? They help us to
Yeah,
flag these. Yeah.
yeah, so I mean, the computers are great, thank God for those,
Mm-hmm.
because I mean, often I'll just put I'll put all the drugs like OTCs onto that system so that it'll flag me and I don't have to think.
That's excellent. Yeah. Not every pharmacist does that. Good for you. Because that's a lot of work. Well done.
Yeah, well, and you know what else is a lot of work? Dealing with someone who's irate because of a drug interaction. So,
Oh, yeah. And rightly so. Yeah.
Yeah, but I mean, so you get kind of lazy when you're dealing with the same patients all the time and the same drug problems. But then as a relief pharmacist, I go in and I'm meeting this person for the first time. So I kind of have to be like, hey, has anyone told you about these things that can happen with your drugs? And half the time they're like, oh, yes, of course, I've been on them forever.
Right.
You know, a lot of people don't really care to talk about those things. They just want to get their drugs and get out. But the odd time, I get people who have been on these drugs for 5 or 6 years, and they're like, wait, what? No one has ever told me this, which is kind of shocking. But the amount of drugs that are prescribed to people is just shocking sometimes. Like a blister pack with 14 or 15 different medications in it that are regularly taken by this patient. And you're like, how many of these drugs are just treating side effects of the other drugs?
Right. And as a pharmacist, you see that. And so, so what do you think is the problem, or what do you think are the main roots of this issue in our healthcare system in Canada?
Well, I mean, there's so many.
I know that's a very broad question, right?
I mean, lack of physician time is one thing. A society that has been told that you can have a quick fix and has kind of come to expect that and deal with the consequences of that quick fix down the road.
Like, I'd rather take a pill than actually discuss why my type 2 diabetes is not controlled, kind of thing.
Exactly. Yeah, it's funny. They just came out with a new oral medication that has been injectable for a really long time, and this was like a new class that came out. It was only injectable, and now they have an oral one. And I'm like reading the pamphlet insert, and it's saying like indications as adjunct to lifestyle, like diet and lifestyle to improve outcomes in type 2 diabetes. And I'm like, oh, it's funny that they put as an adjunct, but we all know that in reality, there's no lifestyle changes happening because no one's paying doctors to go over these with patients. No one's paying, carte blanche for health coaches and that preventative care. So there's that whole thing. Oh man, the reasons seem to be kind of endless.
So it's interesting as we're discussing this, because I'm thinking that, people who are watching this often, I've had people tell me when I'm practicing, oh, you're a pharmacist, you're just a pill pusher, you just want me to take more medications. Is that true? I mean, I see your reaction and I feel the same way, but what would you say to that person who thinks that pharmacists, because we do dispense medication, that we're just wanting people to take more and more medication?
Yeah, I will say that the business of pharmacy does seem to be in direct conflict with healthcare, right? I mean, like, we do get paid to dispense medications, and as a person who wants to do functional medicine and wants to help people get off medication. So like me as an individual practicing pharmacist, and I'd say the majority of my pharmacist friends are all of the same opinion that there's way too many medications prescribed. They're all, I mean, prescriptions that come to us are a disaster, from the way they're written to the wishy-washy instructions to just what's being prescribed. So there's that issue. But then the business of pharmacy, the people who make money and pay me for my work, their business would really suffer if I practiced the way that I would want to practice,
Right. Which is partly why you're pursuing functional medicine, and we are going to. You've said that a couple times. We are going to talk about that and define that in a couple minutes. Just wanted to. Yeah.
Yeah, because if a lot of what you would want to be doing is helping people make dietary and lifestyle changes that would make their diseases better, and then you wouldn't need medications. But as soon as you don't need those medications, well, then you don't pay $10 per prescription
Right.
per every 3 months for a dispensing fee, and then your manager isn't going to be very happy with you.
Interesting. So there is a little bit of a conflict there. And I've seen that with pharmacists that I'm friends with as well as with myself. I think there is appropriate prescribing, and there's times when medications are necessary, helpful, and sometimes even just for a time, and then we can kind of okay, let's get things calmed down, let's get you out of danger, and then let's talk about how to move you forward towards health, right? But I know a lot of pharmacists in my circle who also feel similar, and that they went into pharmacy to help patients become healthy and to help people who were sick become healthy, and maybe that's not always what they're seeing. So it's an interesting conversation to have, right? Yeah.
And by the time you get to talk to the patient, everything has been filled. They've gone to the doctor. They've been waiting there for God knows how long. Then they come, they drop off their prescription. We tell them, go away, come back in a half an hour.
Yeah.
We get this thing, and we're like, hey, so you probably don't need this. It's not a very receptive environment.
Right. That's interesting. It's interesting to think about the workflow that way. I know there's some pharmacies who have put the pharmacist right up at the front receiving the prescription. And sometimes I think maybe that could be a little bit more conducive, if you have the manpower, more conducive to flagging those kinds of things and having those conversations maybe at the beginning. But yeah, you do have a time constraints and labor constraints, and it's not an ideal pharmacy utopia, right, that we work in. Yeah. So I think this is a good lead into functional medicine. So you have been pursuing functional medicine for, I guess, some time now. Could you tell us a little bit about what functional medicine is and why you think that it's relevant to healthcare these days?
Yeah, I started studying that about 2 years ago. I've been studying with the Institute for Functional Medicine, which is just one of the many. I guess there's a couple people that kind of do these courses and whatnot. I really like their approach, so I chose them. And so the idea with functional medicine is that you're getting at the root cause of diseases, and you're not just putting out fires and doing symptom management. And then I really like the way that they do these things, and I'm really drawn to it because you're kind of like being an engineer for like the health of a patient. So for me, I really I really vibe with the way that it's systems biology. It's like, because in pharmacy school, we learned pathophysiology, like here's why the disease happens, here's how, and then we learned the pharmacology. So like, here's the drugs that are going to target these different molecules to help. And then we learned therapeutics, and that was, here's what drugs you would use when, and it's very like specific, patient specific, different indications and whatnot. And then functional medicine takes all of that and it goes, okay, well, that's cool that we know that about heart disease, we know that about diabetes, and we know that about obesity. But then kind of like zoom out, go to like a 2,000-foot view and be like, well, hold up, like what started all of this? Like, are all of these linked to each other? Is there a root that we can find? And I think that's like very cool.
Yeah, it's an interesting concept because I think we have, in traditional medicine right now, we have doctors and we have specialists, and we have, one specialist will be the heart specialist, and then we have the, I don't know, the endocrinologist, or, and they all have their different areas, but it's one body, right? And so we can, right? Yeah. And then the body all works together. You don't walk out the house without your arm or something like that, right? So why would you just study one part of the body when, I often got would get frustrated when I see patients coming in with recurrent, I don't know, skin issues or rashes or something. It's like, well, put some hydrocortisone on it, and it keeps coming back. And it's like, why aren't we talking about why this rash is coming back?
Totally. Yeah,
And
and it's really cool now where functional medicine, I think, is really having its heyday right now because a lot of these things that were done by more like alternative therapies, um, we didn't have any science for. So,
right.
like, all of a sudden, we have science to explain how meditation works, and we have science to explain how interconnected the mind body, the physical body and the emotional body are all connected. We
Mm-hmm.
didn't have that before. And so, because a lot of functional medicine talks about even how powerful the caregiver and the patient relationship is.
Mm-hmm.
They've
Mm-hmm.
done studies where they said, we're going to have doctors who are really great and they like really show a lot of empathy. We're going to have doctors who don't, they're just regular doctors, no change in how they present. And then we're going to have another group that doesn't even see a doctor. This was for like a common cold.
Interesting.
And the people who did the worst were the people, not the people who didn't see the doctor. The
Yeah.
people who did worst were the people who saw like the regular care doctor. They
Wow, I
didn't.
didn't know that. It's interesting.
Yeah, so it's like if you don't have if you don't feel like cared for, it really shows that like interconnectedness. Or it might have been that the doctors were like sort of like cold or off. But
Yeah.
I'll have to find the
Yeah.
study, I'll give it to you. But
Yeah.
the point being
Yeah.
that the patient caregiver relationship is super important. And that was something that I think a lot of, old school family doctors really understood, but we didn't have
Mhm.
science for, and now we do. So that's kind of cool.
So, yeah, and so when we start talking about functional medicine, sometimes people do start to think, oh, this is kind of hokey pokey, this is kind of out there, and but what we're talking about is actually there's a place for functional medicine that looks at the root cause of disease that can be evidence based. This is science based, and
Hmm.
that's why you see the point in pursuing something like this.
Yeah, like I often felt kind of polarized between like the naturopath community
Hmm.
because I liked some of the things that they would do, but then some things that they do, I'm like, oh, what's going on here? You know?
Yeah,
And then there's the regular doctors who a lot of the times I'm like, you're missing the whole point here.
right.
And then so functional medicine I feel like is a really nice kind of mid ground. It's like, having an open mind,
Yes.
but really, doing things only if they're evidence based. And when I'm doing these courses, like the amount of substance in them about like the root cause of disease, and we go like right back to physiology for everything. It's kind of a shock to the system after being graduated for
Yeah.
3
So
years.
when you go right back to the physiology, what does that look like in your studies, or like what does that look like for a patient when you say you're going right back? Are you going right back to just kind of the basics of how the body works? Are you also going back to like, I don't know, the story of the patient, like their history?
Yeah, the
That
history of the
thing.
patient is super important in functional medicine. We do what's called a timeline.
Oh, okay.
So, yeah, we actually borrow a concept from homeopathy called like never well since,
Mm.
where,
Oh,
we just like purely ask the patient, like, is there a time you can pinpoint where you like were never well since that day?
hmm.
And so it gets at the heart of the issue, which is that everything is linked. And so you'll have this like cascade of events, right? Like someone has a car accident and then they, often like that's the point. They were never well since. Or
Right.
like, kind of one of the things the presenter said on stage was because I guess they treat like a lot of doctors and they're like, yeah, the never well since moment was like medical school for them because
Oh,
all of that like crazy stress and being up all
intensity.
night and uh, you know not having any balance in their lives led
Hmm.
to this cascade of events where you just couldn't recover because the body
Hmm.
is really great at maintaining homeostasis and getting you back into balance until a certain point, and then we see it go floop, and then it kind of goes like woo, 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 and we kind of hooped from there.
So that's interesting. So you have all of this pharmacy knowledge as a pharmacist, but then you're also going into this area where you're going to actually kind of, I guess you're kind of going to put the pieces of the puzzle back together for patients, or at least attempt to. And I don't think that that's something that's happening in most family medicine practices right now. Most people would not, or most doctors, I don't think are taking that approach. I don't think that's been part of traditional medicine, really. So
no, it's more like, here's your symptom or your disease, and like labeling people with diseases. Well,
right.
I mean, you know, type 2 diabetes, we label that as a disease and we have that. But like the language is very important, because as we're now learning, you can reverse, or, you know, the like word we're using now is like, we can put it into remission, because we don't want to say reverse quite yet in case we get
right.
like, you know, like the medical police come back and get us. But you know, but
right.
we can put people into remission, certainly. And
we could have conversations that put them in that direction.
Yeah, and so we can get people off all their medications and get them functioning at a regular level, and they don't have type 2 diabetes that is clinically relevant anymore, or it's in remission. So it's kind of cool.
Yeah, and that depends on the patient too, right? Like we don't have a magic pill for type 2 diabetes or a magic formula, but yeah, if the patient is willing and, you know, there are things that can be done, it doesn't have to go necessarily the route that it's going for a lot of people that we see in practice, right?
Yeah, where it's like, oh, here's, put you on insulin.
Yeah. Yeah. And so, you know, you're part of our, thank you for being part of our immune series, and our immune strengthening group. You're one of the admins for the group. What do you think about I guess the topic of, you know, the immune system, inflammation? This is also a very broad question. Do you think that this is a conversation worth having right now during COVID-19 with, you know, healthcare is so on the forefront? Do you think that it's something that is worth looking at for people right now, or?
Yeah, I'm pretty excited that we've seen so much interest in this from, you've got quite the worldwide audience going on that group. So
yeah, it's exciting. Yeah.
Congrats on that.
Thanks.
Pretty crazy when all those invites were coming in. Like,
it's wonderful. Cool. It's wonderful. Yeah.
Yeah, so I'm really excited to see that people are interested in this. It's unfortunate that it took a pandemic for some people to be intrigued in the whole inflammation and the immune system thing, but that's, you know, it's still great. It really pinpoints that you can't, if things are going great and you don't have any reason to be concerned for infections coming towards you, you know, everyone like is like, oh, I'm going to get lots of sleep, it's flu season. Well, it's like, you get lots of sleep because it's beneficial for you regularly.
Right.
We wait until there's an issue, and then we're like, oh, we better do all our Christmas shopping the day before.
Yeah, but, and I do this too. I'm guilty of this too.
Oh, 100%. We all are as human beings, right?
Right.
But it's pretty exciting to see that, and I really hope that these sorts of shifts in thinking are going to stick around, because it's not just the pandemic that is attacking your immune system. It's not something that you have to just not worry about after all of this blows over.
Yeah. And I think, the pandemic has really exposed us for how vulnerable we are and how sick so many of us are, right? When you start to look at the stats on chronic disease and the burden of chronic disease in Canada, and you see that there's millions of people are obese and millions of people have diabetes, and, you know, there's maybe 1 million people in Canada that are not diagnosed with type 2 diabetes, and they're just walking around with it. They don't even know, right? And so we're so vulnerable to these diseases that we wouldn't, you know, we could be a lot, you know, functioning a lot better, right? If we would be a bit proactive, right?
Yeah, well, and especially with COVID-19 because what lands you in the emergency department is an inflammatory process.
Right.
You no longer handle the inflammation that's happening, and you like decompensate really, really fast. You end up in the ICU. And so having a low level of inflammation in your body all the time, as is the case in a person who's obese, makes you more susceptible to these problems. And
Right.
same with your immune system. I forget what the stat was. I think it was like 51%, whatever. But people who are obese have less immune cells running around fighting infection.
Interesting.
Yeah, so we see that empirically now we can see those numbers, right? Like I don't remember who it was, Johns Hopkins or someone came out and said like, hey, yeah, in our hospital, the people who are doing the worst are these people. Like the single most important predisposing
factor.
Yeah. So it kind of highlights like those processes.
Yeah, it's definitely a big issue. Tell us a little bit about what you're doing outside of your 9 to 5 relief pharmacist extraordinaire practice. I know you've got some things going on online. You've got kind of your own business going, right?
Yeah, so whenever I have time, which doesn't seem to be much these days, I do run a website/blog. I'm on all social media.
Okay. Where can we find you?
Yeah, it's KallioFunctionalPharmacy.com.
Okay.
And I guess I'll send you like the spelling of that because my last name is a little funky.
Okay.
Yeah, so KallioFunctionalPharmacy.com. That's my Instagram and my Facebook as well. So I try to post like little interesting tidbits and kind of inspiration as well for healthy living. But of course, you only see the good things I do, as social media tends to go. You didn't see my grilled cheese sandwich from last night.
That's okay. That's okay. We don't need to see it. Social media is so glamorous.
We don't need to see that. But yeah, so I run that. It's like kind of an educational thing, and then I do functional medicine consulting as well. So I help people. Really, because I'm a pharmacist, I can't prescribe you things. So you really are kind of stuck doing the non-pharm, which I think is an advantage. And then I also, so as part of that, I'm developing like an online course for gut health because a lot of the time we find that we really ought to start in the gut. Bringing, even though it's on Do Not Disturb.
It's okay. I actually have a microbiologist coming on the group. We're going to do an interview with her, I think in a week or 10 days or so, and she's going to talk about that. She's going to talk about the gut. It's a big topic, and it's also kind of it's lots of people are talking about this right now. I think it's a good place to start, right?
Yes, that's another thing, that the gut is far less diverse in obese individuals.
Oh, is it?
There you go.
Wow.
But anyway, so I do that. Watch for that course coming out. We're hoping to launch around like November. It's taking a bit of time to develop, but I'm pretty excited about it because, there's a lot of stuff before consult that you could do. Like before you go and spend like $150 to talk about, the first thing that a functional medicine practitioner is going to do is say like, okay, we need to like clean up your diet. We need to like add in some fiber and add in some anti-inflammatory foods, and you should eat more vegetables and stuff like that. And so you're like, well, maybe we should just make a course like that. Do for way less money, make it more accessible. So sometime.
Oh, that's exciting. That's great. Well, let us know, and I'll post it up there, and we'll put all your links up. And if anyone wants to get in touch with you, that would be, I'm sure that they would greatly benefit from your expertise, Kim. That's been great. Well, thanks so much for the chat today. It's been great to, Kim and I actually, this is the first time we've actually met we've been chatting online for a long time, and just kind of she's been helping me out, and we've just been trying to support each other. But this is actually our first meeting, so so we thought we'd record it, for
You heard it here first.
posterity. That's right.
Oh my gosh, that's so funny. Like I'm so proud of what you have accomplished here.
You're so lovely.
You're really going for it, and the speed and you're just like, videos are so well done, and you're consistently putting out helpful things, and I think that's just great.
Oh, thanks, Kim. That's great. Well, we're all doing what we can in this crazy time, right? So, that's great. Yeah. Well, thanks so much, and I'm sure we'll have another chat again someday. Thanks for taking time out of your day off to have this important conversation. So, you're off duty now.
Cool.
Okay. Take care. All the best to you. Bye-bye.